your doula, my doula in the DMV, and today I'm going to be teaching you how to make decisions for you and baby when you're not quite sure what to do. We've all been in that situation before where a doctor gives you information or lack thereof, and they expect for you to pretty much either know what they're talking about and know what decision you want to make, or they pretty much force it onto you thinking that this is the only option that you have. That is never ever the case, and you will always have a say-so in your health care, especially when you're dealing with the safety of not just yourself, but for your baby as well. So stay tuned. I'm going to teach you a little bit more about how to make decisions for your baby using your brain. All right. So when we say use your brain, it's going to be an acronym for obviously the word brain, B-R-A-I-N. Each of these are going to be a very significant way for you to be able to make medical decisions. I promise you, once you start using this, you'll feel so much more secure in your decision making that you'll know that you're making the right decisions. So here we go. Let's go ahead and get started. So here we have B. So let's just say, let's give it a scenario. Your doctor is walking in and they're telling you that, okay, you've been in labor for a pretty long time. I think you need a C-section. So right then, saying I think you need a C-section is not what we call informed consent. That is not informed consent. That is me asking you, or not even asking you, pretty much telling you that because I'm the doctor, I'm saying you need a C-section, and you don't really have much say-so anymore because it wasn't really a conversation. It wasn't really a question. I'm telling you, you need a C-section. So you've been given that knowledge, I guess. You've been told that you need a C-section. So the first thing you're going to do is kick that brain in. The first letter is going to be B. You're going to want to know, what are the benefits? What are the benefits to me? What are the benefits to baby? What are the benefits of you as a doctor for me to do this? Does it get you home early? You know, there's a lot of things. I mean, it's a really good question to ask. The next thing you want to know are, what are the risks? If I choose to go with the C-section, what are the risks to me and what are the risks to baby? This is going to be important because that's going to tell you, what could I be risking if I do not go with this method that they are presenting to me? The next one is very important. Follow up and immediately ask, are there any alternatives? In medicine, there's usually always some type of alternative for doing something. A C-section may not be the only way. It may be the most common way. An epidural is not the only way to relieve pain by medication. There are several other medications used to help with pain throughout birth, but this is just the most common one. This is the most common practice that you use as a doctor. Why are you telling me to do the C-section versus something else? You know, is there something else that I can do that will still give me the same benefits or help out with the same risk? Is there alternative methods that I can choose from? Now that you've asked these really good qualifying questions, you want to start kicking in my favorite, which is the intuition part. So this is going to be your gut feeling. Sorry for my handwriting, guys, but this is going to be your gut. What does your gut tell you after you've learned all of this information? Because now you're educated a little bit more on what you should do. You know the benefits, you know the risk, and you know whether or not there's any alternatives for you to do. If you have time also, if this isn't a life or death emergency, see if maybe you can, you know, either if you have a doula, see if they can look up any evidence-based information that can assist you with knowing if there truly is not any alternatives, if they told you that there's not, or maybe just in his scope, in her scope of practice, those are the only methods that she used or that she's comfortable with using. But maybe there's another doctor there who is comfortable using that alternative method that you found that works for other people. So now you're like, okay, now that I have, you know, my benefits, my risk, and my alternatives, what does your gut tell you you should do? Does your gut tell you that, you know, this is very serious? From what I've been informed of, the C-section may be the best way to go. Because of what I'm informed with, I know that I am not in need of a C-section. And there are several other things that I can do to assist me throughout this birthing process for me and baby to be more safe. I don't think I need this. This is your gut feeling. So after you use your gut feeling, the last question you want to ask your doctor and your care team is, hey, what if we do absolutely nothing? What will happen? What if I just sit here and wait it out? What if we wait for another hour or two? What will happen? What is the worst that could happen? What is the best that could happen? What will happen if we do absolutely nothing? Now, I will tell you, this question usually trips up a lot of healthcare providers because they never really want to do nothing. They always want something to be going on. They always usually want some type of medical intervention because guess what? You're in a hospital. Hospitals tend to be for sick people, although giving birth is not, a sickness. They want to always make sure there's some type of medical intervention being done. Otherwise, you're taking up space. You're taking up somebody's room. Let's speed this up so that we can get on with our lives. Next patient in. We got a whole waiting room full of mothers ready to have their babies. We don't have the time to wait and do nothing. And there are several other risks that can go on. So we want to go ahead and give you this C-section. But again, what happens if we do nothing? Are you going to tell me that if we do nothing, we're just going to have a longer labor? If we do nothing, then, there may be complications to the baby's heart rate. Okay, well, nothing's going on with the baby's heart rate right now. Are we predicting something that has not made its way into reality yet? Let's not predict things. Let's not conjure up some risk just to have some. If there's no risk going on right now, what if we just do nothing? How about we do nothing if you decided that that's what you would like to do? That's how you pick the brain of the doctor so that you can use your brain to make these decisions. And I will tell you, when you begin to use this method, you're not just going to use this for your medical decision making. You're going to use this when you're making decisions in life with anything. And so again, if you ever feel alone in the decision making process where you have to make a decision and you're not really quite sure what to do, always remember to use your brain and make a sound, secure, and safe decision for not just you, but for your baby as well. If your doctors aren't wanting to answer those questions, they're really not good doctors. And you may want to go ahead and use your patient rights and ask for another opinion, because you have that right. You don't have to do anything you don't want to do. You just want to make sure that you have a good support system around you to be able to back those decisions up, whether that is a doula, your partner, a nurse or advocate. And if all fails, you can always comment down below. Reach out to me on my website at mydouladmv.com, Instagram at mydouladmv, or down below in the comments. However you want to do it, let me know. I am here for you. I always will be, because I am your doula, my doula DMV. Have a good day, you guys. See you in the next video. Comment down below what else you want to see. Bye.